Hi, I'm Lucas Kalen.
And I'm Braden Kister, and we're coming to you live from Sheboygan Falls, Wisconsin. We've just gotten word of an outbreak of rabies in the Sheboygan area.
We've called in Dr. Tyson Reschke, a doctor who's had extensive experience in treating the disease, to give us some information on the rabies virus and how it can be treated and prevented.
Thanks for having me.
So Dr. Reschke, for all viewers out there, can the rabies virus be treated or controlled, and how can we prevent the spread of the virus?
If you've been bitten by an animal you suspect to have rabies, you need to get to the nearest hospital immediately. There they will give you a fast-acting shot called the rabies immune globulin. If you wait more than a few days, it is likely too late for you because once you are diagnosed with clinical rabies, it is a virtual death sentence and there is little doctors can do for you.
So Dr. Reschke, I understand that rabies is a problem here in Wisconsin, especially in light of the recent epidemic. But how does rabies affect people around the world?
Well, rabies is a worldwide disease that causes deaths of over 55,000 people a year. This being primarily in southeastern Asia because of the large stray dog population in many large cities and also the lack of quality medical treatment to deal with rabies.
So, to wrap things up, a lot of our viewers have been asking if anyone has ever survived from rabies. If so, what method or methods have been used for those surviving patients?
Well, the first documented survivor of rabies without aid of the rabies vaccine occurred in 2004. It was a 15-year-old girl from Wisconsin that contracted rabies from a bite from a bat.
So what does this mean for the future rabies treatment?
It means that for the first time ever we have hope for a cure or even an effective treatment for rabies once symptoms occur. The treatment used in 2004 is known as the Milwaukee Protocol, and since then there have been several other rabies survivors that underwent treatment similar to the Milwaukee Protocol. This gives us a real cause for hope.
Well, Dr. Reschke, we appreciate you taking your time to speak with us.
It was my pleasure.
Now we'll take you out to an interview I had earlier today with the leading professor in the Rabies Virus Research Initiative at the University of Wisconsin-Sheboygan, James Wheeler. What exactly is the rabies virus, what causes it, and how does it affect the human population?
The rabies virus is caused by a negative strand RNA virus belonging to the genus Lyssavirus, species Rabies. Here, I have a visual representation of the rabies virus. The rabies virus is a negative stranded RNA virus. It has a distinct bullet shape and is filled with RNA, and also has an envelope or membrane surrounding it. Rabies is primarily an animal disease and spreads between animals such as foxes, dogs, raccoons, cats, and bats. When humans are infected, it's purely coincidental, and since humans don't bite one another, it's rarely spread to more than a few people at once.
Now, I understand the rabies virus has 5 distinct phases. Could you walk through that process?
That is correct. The 5 stages of the rabies virus are incubation, prodrome, acute neurological period, coma, and death or recovery. Once the body is exposed to the rabies virus, the incubation period is usually 30 to 90 days, but can range from as few as 5 days to as long as 2 years. Clinical symptoms become apparent during the prodromal period, which usually lasts from 2 to 10 days. Symptoms are usually nonspecific and can include fever, sore throat, coughing, diarrhea, headaches, and nightmares. The acute neurological period begins with signs of central nervous system malfunction, which is what rabies affects. At the end of this phase, patients suffering from the virus often have irregular breathing and paralysis. Soon, the infected fall into a coma. Life support can delay death, but inevitably most patients die of complications from the disease. At this point, the patient will either start to create antibodies and fight off the disease, in which there are 7 cases, or will die.
Well, Professor Wheeler, we appreciate your time. Thanks for educating us on the rabies virus.
It's my pleasure.
Back to you, Braden.
So, Mr. Teller, we know that rabies is a problem here in Wisconsin. But where did the disease originate, and where is it now?
Well, the rabies virus originated in Ushana of Babylina around 2300 BC, where dog owners were fined heavily after bites from their dogs resulted in death. Today, rabies is found in over 150 countries around the world, but is most prevalent in southeastern Asia.
Have there been any major outbreaks of rabies throughout time?
Although outbreaks of rabies pandemics do not occur often, rabies epidemics in communities are not uncommon. In 2009, 93 children in Angolia's capital city of Luanda were killed in a rabies outbreak.
To wrap things up, who is most susceptible to rabies?
Children are at most risk to come in contact with rabies because of their reckless nature around animals. They often don't see animals as a danger, even though they could be put at a serious risk.
Well, thanks, Gary. Back to you, Braden.
It's been a pleasure to share with you, our viewing audience, information on the dangers and history of the rabies virus.
Thank you for watching.